I have to deal with asthma, eczema, and allergies on a daily basis. My life has been full of splotchy red hives that happen each time I go from hot to cold or cold to hot temperatures. Sweat also exacerbates the eczema. Exercise makes my lungs creak like Darth Vader, and I get so itchy at night that I can't sleep without medication. Eczema goes everywhere with me. When I was 12, my dad told me I'd have these conditions forever and that I'd better go do something with them. So I joined CAYAC, the Child and Youth Advisory Council at Alberta Children's Hospital, even though my conditions were managed outside the pediatric healthcare system. I began to realize in those council meetings that self-management was one of my strengths because I had to manage my care like an adult. 4 years later, I was able to help develop and lead a self-management workshop for youth with chronic conditions who are transitioning into the adult healthcare system. In those workshops, I shared how I spent hours on the phone booking appointments and often skipped class to do this because the offices were closed over lunch and after 3 p.m. I explained how in the adult healthcare system you can see multiple specialists, a family doctor, alternative medicine, and counselors, all in a week, and no one will connect the dots for you. To keep track of things, I used my phone as a calendar for symptoms, a checklist for to-do items at appointments, a medication list, and a camera to keep track of my hives. All of this helped my healthcare providers trust what I was saying. During the last workshop I ran, I attended the Canada InfoWay conference. I was so shocked that the things I'd figured out on my own were being studied, put into apps, and promoted. What the heck? Using technology was normal in school and work, but it was the first time I had heard how it could be used in healthcare. E-prescribing would have helped me actually start my medications on time, instead of losing the prescription slips or taking a month until I could make it to the pharmacy. I wouldn't have had to skip as much math class to arrange appointments if I could have used e-booking. It showed me that empowering patients went beyond putting them on committees. It involved giving them the tools to take charge of their own care. Over the past 7 years, I have 695 hours of volunteering with Alberta Health Services. I have served on 9 different initiatives and councils, and I've spent a lot of hours helping improve the healthcare system, but it was digital health tools that enabled me to help myself. My chronic conditions aren't going away, and I will continue to use the technologies I have to manage my health. I just hope that the healthcare system chooses to do the same.